Assessments is in it's 5 minutes period and 15 minutes to assess the patient. Check that the scene is safe to approach. Maintain privacy and dignity by closing the doors and curtains. Sanitize your hand using alcohol and drop. Greet the patient and ask, how would you like me to call you? Introduce yourself by saying, hello, my name is, and I am a pre-registered nurse. Identify the patient using documentation. You can ask, how will you want me to call you? Explain your purpose and question the patient and explain the purpose why you are there. Also ask if they have any allergies to food, medication, or latex, and what type of reaction do they have, and confirm with their red wristband. Now you perform a full hand wash with soap and water, and during your hand wash ensure you ask some icebreaker questions like, what brought you to the hospital? When last did your family come to visit you? Have you taken your breakfast this morning? Now gain the patient's consent to perform the observation. Tell the examiner you ensure the machine is clean and calibrated before use. Consent to touch the brachial pulse and palpate the brachial pulse. Ensure it's and also ask for their hand preferences. Check the blood pressure cuff is the correct size, is fitted, and check it is fitted correctly. Recorded, ensuring patients of tightness and the noise. Verbalize the patient to be quiet and still, and you will do the same while you count their pulse for 2 full minutes. Count pulse rates and verbalize you did it for 2 full minutes. Count respiration rate and verbalize you did it for 1 full minute. Tell patients why you did not tell them, as it would alter your reading. Temperature should be taken carefully and accurately using a 2-hand technique. Checking the ears for signs of redness or infection or warmth. Also ask for ear preferences before checking the temperature, and also confirm if they have any hearing aids on, and make sure the hearing aids is removed before taking the temperature. After taking the temperature, dispose the ear probe in a correct clinical waste bin. If the patient is on oxygen, ask for the target oxygen saturation for the patient, and make sure you take the oxygen saturation on the opposite side of the blood pressure. That's the second arm, the opposite arm. Also confirm the capillary refill time taken, and confirm that the finger is warm and perfused well before taking the SPO2. In case of neuro assessments, you check for the glaucoma score and ensure it is charted correctly. Check for the limb power and check for pupil size, and also check for orientation to time, place, and person. Now it's time for you to document. You can document. There are 3 charts you can use in assessments. You can either use a news chart, a community chart, or most charts, or a GCS chart. Ensure you document appropriately in the appropriate charts, and also calculate the news score and escalate where necessary. Tell the patient the frequency of observation and share it with them. Also recommend some additional tests that will be important for the patient, like MSU, peak respiratory flow meter in case the patient is having shortness of breath. Now, after proper documentation, there are some assessment questions that is important to take. History taken from patient regarding admission. Address the patient's symptoms, concerns, and anxieties. Check for the communication devices, the hearing aids, the glasses, the dentures. Also, pain score appropriately using a scale of 0 to 10. On a scale of 0 to 10, where 0 being no pain and 10 being the worst pain, confirm the pain score. Ask for the medical history and family address, and also check for any risk identified like fraud, perioral malnutrition, and also suggest for referrals with consent to the multidisciplinary team, physiotherapist, nutritionist, dietitian, social worker. Also ask for activities of daily living, feeding, mobility, hydration, washing, dressing, sleeping, toileting, spiritual needs, and positioning. Ensure you demonstrate the CCs of nursing, that's the caring, compassion, courage, communication, competence, and commitment. And ensure you use good language. Ensure you use simple terminology, and ensure the patient understands everything you do, and ensure you take consent appropriately. Ensure you reassure the patient and give compassion. After all this, now this is the stage you close your assessment. Ensure you remove all unsafe items, and also share with patients your actions and what next you have to do. Nice closure of assessment with your patient. Ensure you leave the patient safely and comfortably with a call bell, and sanitize your hand with alcohol and drop. And make sure you check your documentation again after all the assessment stage, and check your time. Thanks for watching. Kindly subscribe to my YouTube channel if you enjoyed this assessment phase of APIE, and watch out for more videos.